She has got another session to attend, so I'm taking up her section. You see, when there's a low vision child, and if that child has got a lot of motor development problems, orientation problems, decreased life experiences, and decreased scholastic performance. So that is the reason why you need to treat a low vision child as early as possible. Now, how do you know that a child has got low vision? It's very difficult because children, very small ones, are pre-verbal, they cannot talk. They won't tell you that they can't see well. So for that, you need to know the visual developmental milestones and need to know whether the child is following those developmental milestones or not. And if he's not or she's not, then you at once come to know that he has got visual impairment, maybe a very profound one. So these are the milestones to remember. At 29 weeks of gestation, yes, when the baby is in the womb, pupillary reaction to light is present. Fixation and horizontal following of moving objects, horizontal tracking is present from birth to 1 week. Vertical tracking occurs from 4 to 8 weeks, blink response in 5 weeks, and by 3 years of age, the child will have 6/9 visual acuity. And if these milestones are not followed, the child has visual impairment. So vision assessment is difficult in children, but not impossible. In early infancy, up to 4 months, you can check for pupillary reaction to light, head turn towards a light source, or blink response to bright light. For infant and pre-verbal children, you can use the Catford's drum, preferential looking tests like grating acuity, visually evoked potentials, and in verbal kids, you can use tumbling E, HOTV test, Sheridan-Gardner, Leah symbol tests, and there are a host of other tests which one can use. So for kids, assessment of the functional vision is very, very important. Now, what is functional vision? Functional vision is the purpose for which the vision is being used. So in little kids, you can't test their visual acuity. So you need to know what level of vision he's got. First of all, whether he's got any vision or not. If it is present, what level of vision he has got, and what is he using it for? So that forms your baseline from which you can prescribe your low vision devices. So for that, you'd have to test fixation, eye movements, and see what kind of work he can do or activities that he's doing. So this is all detailed stuff. It will take an entire lecture on its own. So I'm just going to avoid going into details. Just remember that functional vision assessment of little children is very essential. If you can't perform, which probably most of us won't perform it in our clinics, one can